How to recognize wound dehiscence after surgery. If you have recently had surgery, you might be wondering how to identify wound dehiscence. This condition occurs when a surgical incision reopens either partially or completely. It typically happens within the first 3 to 10 days after surgery, during the early healing phase. So, how can you tell if your wound is dehiscing? First, look for a visible opening or separation in your wound. You might see gaps or holes where the edges of your incision are no longer closed. In severe cases, deeper layers of tissue or even organs might be exposed. This is a clear sign that you need to seek help. Next, check the stitches, staples, or surgical glue used to close your wound. If these materials appear loose, broken, or missing, it could indicate that dehiscence is occurring. Another important symptom to watch for is pain. If you experience a sudden pulling, ripping, or popping sensation around your incision, this could signal that the wound is starting to separate. You should also be alert for any bleeding or unusual fluid drainage. Blood, clear fluid, pink discharge, or pus-like drainage can come from the wound. If the fluid has a bad odor, this may suggest an infection, which is a serious concern. Additionally, redness, swelling, or warmth around the wound can indicate inflammation or possible infection. These signs should not be ignored. Fever or chills are other symptoms to be aware of. These can indicate that an infection has developed in the area of the wound. If you notice any of these symptoms, especially an opening in the wound, pain, bleeding, or fever, it is essential to contact your healthcare provider immediately. Early detection is vital to prevent complications such as infection or delayed healing. After surgery, there are practical steps you can take to support your recovery. Avoid activities that put strain on your wound, such as heavy lifting or strenuous exercise. Coughing without support can also be harmful. Keep your wound clean and dry, following the instructions provided by your care team. It is also important to monitor your wound daily for any changes in appearance or sensation. Lastly, make sure to follow all post-operative care instructions carefully, including medication use and wound dressing changes. Understanding these signs and following these guidelines can help you take prompt action if wound dehiscence occurs, supporting a smoother recovery after surgery.